Good afternoon, everybody, and welcome to our webcast today on participating in the 2023 CAHPS Home and Community-Based Services, or HCBS CAHPS Survey Database, What You Need to Know. My name is Dale Schaller, and I'll be moderating our session today, which is sponsored by the Agency for Healthcare Research and Quality's CAHPS User Network. Next slide, please. We have just a few technical issues to cover. In case you have any trouble with your computer audio, you can use your phone to call into Zoom by clicking on phone call, finding the dial-in number that you can use and the meeting ID, or you can have Zoom call you back by entering your own phone number. If you have a poor connection, you can always try to log off and log back in. And most importantly, for today, to ask a question, which we encourage you to do, you use the Q&A icon and just enter your question. We ask if you could also provide your name and your organization. It helps us to know where you're coming from. You should also know that the raise hand and the chat features at your end are disabled for the webcast today. So please just rely on the Q&A icon. So with that, we'll move to an introduction of our speakers today. And I'm really pleased to start with John Bakdash, who is a social science analyst with the Agency for Healthcare Research and Quality's CAHPS and SOPS Survey of Patient Safety Culture program. From the Centers for Medicare and Medicaid Services, we're pleased to have Melanie Brown, who is a technical director in the CMS Division of Community Systems Transformation. Following Melanie will be Amanda Hubin, who is a consultant with the Lewin Group, who is working on the HCBS CAHPS initiative under contract to CMS. And finally, we'll hear from Josh Rubin, who is the lead research associate for the HCBS CAHPS database at WestAt, which is the prime contractor to AHRQ for the CAHPS database. And I'm Dale Schaller, again, your moderator. I'm a member of the CAHPS team, and happy now to move to the next slide just to preview our agenda, which is quite straightforward. We have 3 items. We want to, first of all, discuss the Home and Community-Based Services, or HCBS initiative sponsored by CMS and AHRQ jointly. We'll then describe the HCBS CAHPS survey itself, and then move to a discussion of the HCBS CAHPS database. And then we'll leave as much time as possible for your questions and answers, which we will address at the end of the webcast today. So with that, John, I'm happy to turn it over to you.
Thank you so much, Dale. Hi, my name is John Bakdash. I want to thank you for joining us today. I want to welcome new and seasoned users of CAHPS surveys. The CAHPS program stands for Consumer Assessment of Healthcare Providers and Systems. Today, I'm going to be giving you a brief background about AHRQ, as well as a brief overview about the CAHPS program and other CAHPS surveys, besides HCBS. Next slide, please. I'm going to tell you a little bit about AHRQ, the Agency for Healthcare Research and Quality, what AHRQ is and what AHRQ is not. So you can see how the CAHPS program fits within the agency activities. AHRQ is a research-based agency of the U.S. Department of Health and Human Services. We are the lead agency charged with improving the safety and quality of America's healthcare system. So AHRQ has a number of competencies in health system research, practice improvement, and data analytics, and we invest in research and evidence to make healthcare safer and improve quality. So what AHRQ is not, we are not a regulatory agency. We encourage submission to our voluntary databases, use of our tools, but we do not require it. It's possible another agency may require instruments or tools that are developed by AHRQ, but AHRQ itself does not require it. Next slide, please. So just to give you an overview about the CAHPS program and measuring patient experience, there are a variety of different aspects of patient experience that the CAHPS program measures, whether it's care coordination, courtesy and respect, getting information. And patient experience is really about measuring how often something happens to patients or what happened to them, rather than whether or not their expectations are met or they in terms of like satisfaction. So what happens and how often something happens during their healthcare encounter. And for home and community-based services, you can really substitute patient with person or individual as the more common terms, but as a whole, we refer to CAHPS as assessing patient experience. So when I say patient experience, think of person or individual for home and community-based services. And the CAHPS programs are really developed to capture the patient's voice. Patients are instrumental during the development. They provide input into the questions that are asked, make sure that patients understand the questions. They're extensively tested as what is important to patients about these various aspects of their care. Next slide, please. You can see here there are a variety of different CAHPS surveys in different settings, from assessing experience with providers to facilities to condition-specific care. And in the case of home and community-based services, it's assessing it at the program level. So it falls under that orange puzzle piece of experience with health plans. Next slide, please. You can see just the highlight there around home and community-based services. Next slide, please. So here are the essential uses of CAHPS surveys. So this includes quality improvement, public reporting, certification and recognition, value-based purchasing, and health services research. Thank you so much. Now I'm going to hand it off to Dr. Melanie Brown for her presentation on HCBS quality measurement alignment. Thank you.
Thank you, John. Good afternoon. I'm Melanie Brown, Technical Director at CMS in the Division of Community Systems Transformation, which is within the Center for Medicaid and CHIP Services, Medicaid Benefits and Health Programs Group. I'm going to be sharing more about the Home and Community-Based Services, or HCBS CAHPS Survey. For those of you that may be hearing about the HCBS CAHPS Survey for the first time, the HCBS CAHPS Survey was developed to support states with quality assurance and improvement by helping to identify areas that need improvement based on the experience of the HCBS participant, and then allow for comparison across HCBS programs, states, and populations. The HCBS CAHPS survey is the first Medicaid experience of care survey that has been tested and validated for use across HCBS programs and for all of the different populations that are served through HCBS programs. Next slide, please. So I think it's helpful to start by talking about this HCBS quality framework. This framework was developed by CMS several years ago, but I think it does a good job of sort of conceptualizing the overall sort of long-term goals for our quality initiatives, as well as the inputs and outputs that need to be implemented in order to reach those goals. So the programmatic aims are ensuring the safety and well-being of people receiving HCBS, promoting high quality and accessible HCBS, and then promoting value-based care and services for people receiving HCBS. Now, those programmatic aims are achieved through some specific actions, which include measuring quality and outcomes, analyzing data, tracking and trending data, reporting on both internally as well as publicly on quality and outcomes, and then using the data to detect and respond to individual and system level problems. And then finally, promoting improvements in quality and outcomes. And the ultimate goal is that those activities, keeping the programmatic aims in mind, would lead to an improved experience of care, greater independence, health, well-being, self-determination, and community inclusion for individuals that require home and community-based services, as well as more cost-effective and appropriate care and services provided. Next slide, please. Now, CMS did also identify 5 strategic strategy elements that are also intended to inform the framework. And I think you'll see here where both the development and use of the HCBS CAHPS survey is reflected for many of these elements. So the elements include promoting development and use of standardized, validated, and meaningful quality measures, aligning, coordinating, and addressing gaps in federal and state measurement reporting, as well as monitoring requirements, activities, and systems, excuse me, developing, implementing, and supporting use and availability of a comprehensive set of quality improvement, quality assurance, and technical assistance strategies and tools, improving oversight and enforcement, as well as addressing gaps in oversight and enforcement to better support states to comply with federal regulations. And number 5 is supporting development, testing, and implementation of value-based purchasing and alternative payment models. Next slide, please. So now we're going to talk more specifically about the features of the HCBS CAHPS survey. The HCBS CAHPS survey assesses whether services are person-centered, and it does prioritize what is important to the participant. So whether or not participants are able to self-direct and control their own plan and how their services are delivered. The HCBS CAHPS survey includes reliable and valid survey measures, which were developed with input from a wide range of stakeholders, which includes consumers and actual participants in HCBS programs. And the HCBS CAHPS survey was originally tested through CMS's Testing Experience and Functional Tools, or TEFT demonstration. The HCBS CAHPS survey is applicable across delivery systems, so it can be used in both fee-for-service and managed care programs, which can allow for comparison of all HCBS programs that are operating within a state. It does also apply across populations of individuals receiving home and community-based services. So target populations include older adults, persons with physical disabilities, persons with intellectual or developmental disabilities, individuals with acquired brain injury, as well as individuals with mental health conditions or substance use disorders. There are also a number of ways that the HCBS CAHPS survey can be administered. It is fielded by interview that can be conducted either over the telephone, by video, or in person. There are actually some states that are using computer-assisted telephone interviewing as well to administer the survey. The survey does have a maximum of 69 core items, but the number of items that each respondent would need to respond to would be dependent upon the types of services that they're using. Next slide, please. So I just want to briefly summarize the key features of the HCBS CAHPS survey. As I said, it is person-centered. It's very much focused on the experience of the person receiving the home and community-based services. It is cross-disability, meaning that it can be used across the various population of individuals that require home and community-based services. Its development was aligned with the CAHPS requirements, and the frequency of use can be determined by the survey sponsor. The HCBS CAHPS survey is in the public domain, so it is publicly available for voluntary use in HCBS programs as part of quality assurance or improvement activities, as well as publicly reporting. It is also applicable for both fee-for-service and managed long-term services and supports environments. And CMS does provide technical assistance for groups or entities that are interested in using the HCBS CAHPS survey. Next slide, please. So in terms of the unit of analysis, and so what we mean in this context is the unit for which the survey results or scores will be produced. And that is typically the accountable entity or the operating entity that would be responsible for managing or overseeing the specific HCBS services or program that are being assessed. So that means that the unit of analysis can vary. It could be the state Medicaid agency. It could be a county or other non-state governmental entity. It could also be a managed care plan. Next slide, please. So other important considerations, if you are considering using the HCBS CAHPS survey, there are 19 composite measures derived from the HCBS CAHPS survey that were endorsed by a consensus-based entity. That means they've gone through a rigorous process of assessing things like reliability and validity to receive that endorsement. And those 19 composite measures include 7 composite measures, 3 global rating measures, 3 recommendation measures, and 6 single item measures, which assess unmet needs, and physical safety. CMS does work really closely with our federal partners, AHRQ, as well as their contractor, Westat, and they manage the HCBS CAHPS database, which offers free access to aggregated results for analysis and use. CMS does also contract with the Lewin Group, who provides technical assistance to states, managed care plans, and other groups that are using or interested in implementing the HCBS CAHPS survey. Next slide, please. So there have been several sort of policy and regulatory releases over the last 2 to 3 years by CMS, which have a relation to the HCBS CAHPS survey. In July 2022, CMS released the first ever HCBS quality measure set through State Medicaid Director Letter 22003. The intent of that measure set is to promote more common and consistent use, both within and across states, of nationally standardized quality measures in HCBS programs. Implementation of the HCBS quality measure set is also intended to create opportunities for CMS, states, and territories to promote health equity and address disparities in health outcomes among people that are receiving HCBS. And earlier this year, CMS did release 2 informational bulletins. One was an update of the HCBS quality measure set that was originally released in 2022. And the second informational bulletin laid out requirements for the Money Follows the Person demonstration program, which is a CMS demonstration program that's focused on rebalancing of institutional and HCBS services. They will be the first to begin using the HCBS quality measure set in 2026. So if you're interested in reading either of those, we can certainly point you to where they're located on Medicaid.gov. And finally, in April of 2024, CMS released the Ensuring Access to Medicaid Services Final Rule. And that is essentially a regulation. And among many provisions, one of the provisions is that all states and territories will be required to begin reporting on the HCBS quality measure set in 2028. So next slide, please. So what is the relationship between all of those sort of policy and regulatory guidance documents that have been released? Well, the HCBS quality measure set does actually include measures from HCBS CAHPS survey. So the following HCBS CAHPS measures are included in the HCBS quality measure set. They include scale measures, measures of unmet need, and personal safety measure. And again, the intent is to facilitate comparison both within and across state Medicaid programs using a standardized set of measures. Next slide, please. Okay, and I will now turn it over to Amanda Hubin from the Lewin Group to talk about the technical assistance that's available.
Thank you, Melanie. My name is Amanda Hubin. I'm a consultant with the Lewin Group, which is a healthcare policy consulting firm currently contracted by CMS to provide technical assistance, ongoing maintenance, and expanded use of the HCBS CAHPS survey. We'd like to share and remind those that have adopted HCBS CAHPS or are in the planning stages of a few resources and technical assistance opportunities available to you. Next slide, please. For more information, you can find a wealth of resources on the AHRQ, CAHPS, and Medicaid.gov websites. We have technical assistance documents available, such as technical guidance, FAQs, example scripts for interviewers, the survey instrument, and more. The resources include best practices for surveying, sampling, and improving response rates. Updated TA materials were uploaded in 2021. You can also contact HCBS Measures at lewin.com for individualized technical assistance related to the HCBS CAHPS survey administration. Technical assistance is available to states, managed care plans, and other HCBS CAHPS users. Next slide, please. CMS and the Lewin Group hosted and facilitated HCBS CAHPS state technical assistance work groups for interested states and managed care plans. The work group met 5 times, with the final work group being held in April of 2024. The work group had objectives including supporting the adoption and successful administration of the survey across states and identifying and promoting best practices in survey implementation. The Lewin Group is providing technical assistance for the survey through appointment-based technical assistance calls. The technical assistance team is available for one-on-one meetings with interested parties to discuss the survey and answer questions on survey design, adoption, implementation, state approaches, and the HCBS CAHPS database. We have an upcoming appointment-based technical assistance call block on Wednesday, July 24th. Our team is also able to schedule calls at state's convenience. If you'd like to meet to discuss the HCBS CAHPS survey and adoption, please reach out to us at hcbsmeasures@lewin.com, and we can send over some potential meeting times. You can also subscribe to the HCBS Measures listserv at that same email address to receive information on upcoming events and registration information for appointment-based technical assistance calls. Thank you, and at this time, I'll turn it over to Josh Rubin at Westat to tell you more about the broader CAHPS database.
Good afternoon. I'm Josh Rubin. I'm a lead research associate for the HCBS CAHPS database here at Westat. Next slide, please. So the CAHPS, let's talk about the CAHPS database overview. The CAHPS database is a central repository of data for the health plan survey, CAHPS health plan survey, the CAHPS home and community-based services HCBS survey, the CAHPS child hospital survey, and it also has reporting data for clinician and group survey, which suspended new submissions. The database is designed for two major applications. The primary purpose is to facilitate comparisons of CAHPS survey results by and among survey users to assess performance. The database also provides de-identified data for research purposes. Participation is voluntary and open to all users, and the database is funded by the Agency for Healthcare Research and Quality and administered by Westat through CAHPS User Network. Next slide, please. So the HCBS CAHPS database is a collaborative initiative between the Agency for Healthcare Research and Quality and the Center for Medicare and Medicaid Services. The database will facilitate comparisons of HCBS CAHPS survey findings by individual states and HCBS program types. Participation is free and open to all states and managed care plans on a voluntary basis. Our next data submission period is from August 5th to the 23rd, and we'll be intaking data from January 1st to December 31st, 2023. Noting that we had in past year participation from 7 states in 2024 after starting the database just 2 years ago. Next slide, please. Some of the benefits of participation are that any data submitter will receive a customized report, private feedback report, that compares their states or managed care plans' individual program type results to the overall HCBS CAHPS database results. That data will be included in other reporting products, such as the AHRQ Data Tools website, which contains aggregated HCBS results, annual chart books, and de-identified research data sets. We'll discuss these other reporting projects a bit further along in upcoming slides. Also, free technical assistance is provided to all data submitters and users of the reporting products. Next slide, please. As I mentioned on an earlier slide, the HCBS CAHPS database online submission system opens once a year, generally in August, and this year will be opening August 5th. Organizations interested in submitting data need to complete 4 easy steps. The first step is to register for an account, where we ask for some general information regarding the state or managed care plan. The second step is that the state or managed care plan will need to provide a signed data use agreement, which specifies how the data will be used and stored. Step 3, prior to data submission, we request a copy of the survey instrument used, where we'll review it to ensure it adheres to CAHPS standards. We would encourage submitters to send their survey instruments to CAHPS, the HCBS CAHPS database prior to data collection if possible. So it'll expedite the review. And step 4, the state or managed care plan survey vendor needs to provide a data file that has been formatted to the CAHPS database specifications, noting that this year's data specifications for HCBS will be available shortly on our data submission site. Next step, next slide, please. The CAHPS database products has produces 4 distinct products. The AHRQ Data Tools website, where users can view and download reports. A private feedback report only provided to submitters to the database, which compares the states or managed care plans results to the database average. a chart book which displays summary level database results, and we also make available research data sets, which are de-identified data files that can help researchers answer questions related to the experience of care. We should also note that some of these products may not be available as they're dependent on the volume of data we receive. We do encourage states and managed care plans to submit data to ensure we can provide all of these products. And next slide, please. So this next slide is an example of a private Excel report. This is the reports that are sent to the submitters upon request. The report shows how a particular state or managed care plan performed in comparison to the overall database averages. Some items shown as the database average and significant tests are dependent on the amount of data received. Next slide, please. The next slide is an example of how the data is reported on AHRQ's data tools website. Here we have an overall composite score and scores for individual questions that comprise the composite measure that would be displayed. Next slide, please. HCBS programs can be assured that their data are kept confidential. No program names or other identifying information is ever made publicly available. Only aggregated program data is ever publicly reported. Next slide, please. And as I mentioned earlier, the CAHPS database team at Westside offers free technical assistance with database submission issues, responding to questions regarding data specifications and the data submission process in general. We also offer assistance to any user with our public reporting products, such as AHRQ's Data Tools website and how to obtain and use the research data files. The CAHPS database team can be contacted at the email address HCBS CAHPS database@westit.com. And the phone number is also listed here. Thank you. And I'm now going to turn things back over to Dale for the Q&A.
Great. So thank you very much, John and Melanie, Amanda, and Josh. Thank you for turning your cameras back on so that we can field questions. It appears that you have done a pretty fabulous job at covering the content of interest to our participants. We have very few questions. If you do want to ask a question at this point, this is just a reminder how to do that. We did have a couple of questions that I will just cover kind of for the record. There will be slides from today's webcast available in several different ways. There will be a posting at some point on the AHRQ CAHPS website. And there will be a Gov delivery announcement of when those are available, I believe, to those who have registered for the webcast. Else, you can always request a copy of the slides directly from the CAHPS database team, and I'll show you how to reach us at the conclusion of our webcast. Do we have any? Yes, we do have another question that just came in terms of and I believe this would be a sort of question either for you, Melanie, or Amanda. Is data collection, if by phone, required to take place in the United States? Who wants to take that one?
So I can try to take it. So I guess I would ask a follow-up question. So I'm assuming that this is a person who is receiving Medicaid funded home and community-based services, but is perhaps temporarily out of the country. So the requirement obviously would be that they are receiving Medicaid HCBS, right? If they are temporarily out of the country, I think you could still do an interview. There's nothing, I think, within the technical assistance guide that says that you cannot do a telephone interview if the individual is outside of the country. I guess the only question I would ask, just to ensure that that person is an actual recipient, a Medicaid beneficiary who's receiving home and community-based services. So unless CAHPS, and I should defer to my colleagues at AHRQ, has a requirement around sort of only conducting the interviews while the individual is in the country, that doesn't, I believe, exist in the HCBS CAHPS technical assistance guide.
Well, Melanie, we have a clarifying, I think, piece of information for the question. If I'm following this correctly as well, that the question relates to the agent making the call, whether they need to be located in the US or not, because there are call centers, as you know, all over the world. And I think that's the nature of the question.
Thank you for clarifying. So CMS does not have sort of vendor requirements around sort of who can hire. We ask that you do make sure that the vendor is familiar with the survey. And we also have encouraged other states that have sort of asked, you know, who should we pursue for vendor, to look at vendors who may also already be fielding surveys for perhaps another program or within Medicare, who has much more, I think, stringent vendor requirements. But there is at this point no requirement. So yes, in theory, if your state procurement process would allow you to procure a vendor outside of the US, there would not be a CMS requirement that would prohibit that.
Yeah, that's really helpful. And thank you for the clarifying points on the question. So we have a question, I think, Amanda, that might be fielded by you. The question is from Kelly Mendonça, who asked if more states are requiring HCBS CAHPS surveys in their managed care contracts, given your role with TA at Lewin. What's your sense of those requirements?
Thanks, Dale. I'm not sure I can answer this question exactly. What I can say is that we are seeing more and more states adopting the HCBS CAHPS survey and engaging more with their managed care plans about actually, implementing the survey. I cannot tell you, though, if they're doing it through managed care contracts. That's not information we have at this time. But thank you for your question.
Melanie, do you have any insights on that as well?
I don't think so. I'd be happy to follow up. We can check and see if there's any additional information, but I don't think there's anything that I can add today.
Okay, great. We do have a question, I think, Josh, for you. It relates to the database and what data will the data file layout and submission specifications be available? That is, when will that be available?
It'll be available probably in the coming weeks. There is one change for returning submitters this year that we have switched from. We previously asked for submitters to submit flat ASCII files. We're switching over to a CSV format this year in the data specifications. There aren't any substantive changes really to the data specs, but the only change would be that we're asking for CSV files to be submitted. So we expect that to be up in the coming weeks. Ahead of data submission, which opens in early August.
Okay, great, thank you. See if we have any other questions. Yes, we do. From Barbara Piscor, how will language issues be handled? This may be a question for CMS or even AHRQ, John. This is a major issue in the caregiver area, and I suspect with interviewing. So I guess the question is multiple languages, and I know this has been under discussion with the collaborative team. Who wants to take that one?
I can start, and others can jump in. So there is a Spanish version that is available. We are currently in the process of working with a potential translator to add an additional, I think maybe 10 to 11 additional language versions to make those available. But I think we're probably a good maybe 6 months to a year away from having those available. But we do recognize, we hear from states all the time that having the survey available in additional languages would be helpful, and we are working on that. So if anyone else has more current information about languages, please feel free to jump in and add.
Yeah, I think that's pretty comprehensive. Thanks, Melanie. Other questions? Please don't hold back. Well, I will say, unless our speaker team has any objections, given the fact that we have covered a lot of the material in a short period of time. If there are no further questions, I think we can move to the closing slides, if you can do that for us, Michelle. So One way to keep the dialogue going is by signing up for what we have as a kind of an email alert system. You can get routinely CAHPS updates by registering with the Gov Delivery listserv, and you can find that on the CAHPS site in an upper right-hand corner, and you just select the icon that takes you to a list of publications and program information that you can sign up for, and then you would get regular announcements related to this program and other CAHPS programs that AHRQ sponsors and all the technical resources that are available. We can go on to the next slide. If you have other questions that didn't occur to you today, you can always forward them to the CAHPS database email box, which is at HCBS CAHPS database at westat.com. You can use the toll-free number at 1-855-580-4657 or visit the CAHPS database website at www.caahpsdatabase.ahrq.gov. And I believe that will take us to the end of the webcast. I want to just thank John and Melanie and Amanda and Josh again for a really succinct and very helpful, informative webcast today. Thank you all for joining. And please stay in touch. Keep us informed of where you are, what other questions you might have, and we're happy to reach out and help wherever we can. So thanks again. Please take a moment when you exit the webinar to complete our evaluation. It only takes a minute or two. And thanks again. We will see you next time.